So most Americans don't take action until they have problems. And the beauty about nitric oxide and what we've been able to demonstrate clinically and scientifically over the past 20 or 30 years is that it can reverse chronic disease.
I believe I do not know very well, and probably the audience also, what is nitric oxide?
That's a very good question. It's probably one of the most important molecules produced in humans. It controls blood pressure. It controls oxygen delivery to every organ, tissue, and cell in the body. It's how our immune system fights off pathogens from bacteria and viruses. But really, it's a cell signaling molecule. So it tells the body what to do. And so when we lose the ability to make nitric oxide, there are a lot of things that go wrong. We get high blood pressure, we get sexual dysfunction, we lose our memory, we become immunocompromised, and we become more susceptible to infections. You know, especially over the past 3 years, we've realized that the people that got sick and died from COVID were the people who couldn't make nitric oxide. So it's a very important molecule that does a number of important things in biology.
Not very well known, not very famous.
No, you know, we've been doing this for more than 20 years, and there's a gradual awareness around nitric oxide, but still we're not where we need to be. And, you know, that's why it's so important what you're doing is help us educate the masses on nitric oxide so more people can understand what this molecule is, how important it is for their own health, and then understand what they're doing that may be disrupting nitric oxide production. And then once we understand that, we can employ therapeutic strategies to restore nitric oxide production, and we see people get better. And that's an amazing thing.
Yeah, and that's why I was so happy that you could be here participating, because I think this information needs to be more spread out. So please tell us, how is it how nitric oxide is produced in the body?
Well, the first pathway to be discovered was back in the early 80s. Well, actually throughout the 1980s, that there was an enzyme called nitric oxide synthase. That enzyme is found in the lining of the blood vessels in what we call our endothelial cells. And that enzyme makes nitric oxide upon activation or upon stimulation. And that's what's responsible for the second-to-second regulation of blood flow, blood pressure. You know, so when we are about to exercise, right, we have to increase the blood supply to our heart or to our skeletal muscles. And you do that through the production of nitric oxide. So that's the first pathway to be discovered. The second one was through diet. And that's really only been about 20 years ago when it was recognized that the mechanism of a plant-based diet or a vegetarian diet is due to the inorganic nitrate content of certain foods that can be broken down and metabolized in the body into nitric oxide. So now we have two established pathways to make nitric oxide. One can compensate for the other. But when you lose the function of the nitric oxide synthase enzyme in the blood vessels, we call that endothelial dysfunction. Then we have to rely more on the dietary pathway. But when both of those pathways are dysfunctional, then that's when you get into symptoms of nitric oxide deficiency. Your blood pressure goes up, you develop sexual dysfunction, you lose your memory, you develop insulin resistance and type 2 diabetes, you develop exercise intolerance, you can't exercise. And so that explains a lot of the symptoms of many chronic diseases today.
Yeah. So this reminds me something I studied many years ago. I'm not an acupuncturist, but I studied a little bit of Chinese medicine, the traditional Chinese medicine. And I remember one of the things we say in traditional Chinese medicine is every disease starts in the blood. If the blood is not flowing, you will have a disease. So now you're telling the nitric oxide is responsible for this good flow of blood in the body. So I would correct the Chinese and say, okay, every disease starts in nitric oxide because you need to flow everywhere. The blood needs to flow to bring the nutrients, to clean the blood, the body and everything.
Yeah, you know, you make a very good point, because as you know, in Chinese medicine, they call that qi. Right? So in 2009, we published a very important seminal paper where we discovered the nitric oxide activity of a lot of traditional Chinese medicines. So our interpretation from that paper was that nitric oxide is qi that's been described for thousands of years. And that's what controls, you know, the circulation, the activity of the blood. And as you said, if you can't get the oxygen or nutrients to individual cells of the body, then those organs and tissues fail. And that's the role of qi, which is nitric oxide.
Oh, wow, that's incredible. That's incredible. So they were somehow for thousands of years, they discovered that, they know that.
They were right.
But science now comes and like, okay, that's what it is. And it's wonderful because it's also scientific base. It's important for most of us Westerners also to understand and to have this base to know that we need to do something. So you're mentioning when I'm going to ask you again because it was quite fast. Everything that happened when the person do not produce nitric oxide. So you talk about the memory and especially in relation to the autoimmune, I'm going to go there. But before, because it's not only autoimmune, it seems to me very important for every single human being, right?
That's right.
Yeah.
So when you can't make nitric oxide, typically the first sign and symptom is sexual dysfunction or erectile dysfunction. That occurs in both men and women. And if you think about it, it makes sense because when we become stimulated, we have to dilate the blood vessels of the sex organs and to get engorgement and to get erections in both men and women. So if you can't make nitric oxide, the blood vessels don't dilate, you don't get the engorgement, you develop erectile dysfunction. So that's what we consider the canary in the coal mine. It's probably one of the first signs and symptoms of lack of nitric oxide production. The other and
that's
next,
very good because we know there's some medicines there that was discovered because of blood flow.
No, that's right.
Yeah.
And these medicines work. These medicines are dependent upon nitric oxide. So, the PD5 inhibitors that are used for erectile dysfunction only work if the patient can make nitric oxide. And we know now in 50% of the patients that are given these drugs, they don't respond with better erections. And that's because their body's not making enough nitric oxide to activate that pathway. So now we have data showing that you can take non-responders and turn them into responders if we just stimulate them or restore their nitric oxide production. So that's a very important concept. And then the next is you have an unsafe elevation in blood pressure. And 2 out of 3 Americans have an unsafe elevation in blood pressure. And that's the number one risk factor for the number one killer of men and women worldwide.
Yeah, and I don't know, I think here, but I'm from Brazil. In Brazil, we normally say the high blood pressure is the silent killer because...
No, that's exactly right.
Yeah, you're not seeing, but then this is, like you were saying, is the number one cause of death. It's something quite dangerous. Yeah.
And then in 2011, I believe, we discovered that nitric oxide is critically important for insulin signaling. So if you can't make nitric oxide in the cell, you become insulin resistant, type 2 diabetes, and that's dependent upon nitric oxide. So again, if you can't make nitric oxide, the cell doesn't get the signal to take insulin and then translate that into an increase in glucose uptake. So you get insulin resistance, hyperglycemia, type 2 diabetes.
Wow.
And then really there's a number of symptoms that develop after that. When we recall memory, we have to increase blood flow to the prefrontal cortex, and that's dependent upon the ability to produce nitric oxide. So if you can't dilate and perfuse certain regions of the brain, then they become dysfunctional and you develop mild cognitive disorders, vascular dementia, and then eventually Alzheimer's. So every single age-related chronic disease that we deal with in the Western world, or really around the globe, can all be explained by a lack of nitric oxide production.
Wow, wow. So we definitely have to scream about nitric oxide.
That's right.
Talk to everybody, we scream about, hey, come on, you have to produce nitric oxide. So how do I know? So I think you already said by saying, what is the signs of that? So how do I know if I have decreased NO production? So with the only, let's say, if I don't have sexual dysfunction, or let's say as we get older and less excited about sex, the hormone has dropped. So whatever sign it could be, besides could be high blood pressure, or is there any way that I can measure how much NO I have? I would say nitric oxide because I want people to memorize this name.
Right. There's really not. We can measure, blood and plasma and tissue samples in the research lab, but clinically, there's really no lab you can pull, because nitric oxide is a gas, and once it's produced in the body, it's gone in less than a second. So, unlike vitamin D or cholesterol, which you can pull blood and get a number, and then you can correlate that number to normal or low or high, there's really not a lab for nitric oxide. And that's been a challenge for, really the past 30 years, because we have to rely on symptoms. But back about 12 years ago, I developed a salivary test strip that you can apply some saliva to the end of this test strip, and within a couple of seconds, you'll see a color change. And that's a pretty good, what we call a proxy for total body nitric oxide production or availability. So these test strips are measuring salivary nitrite, which is measuring your body's ability to produce nitric oxide in the oral cavity. But I tell people it's a good tool to have in your toolbox, but it's not the only tool you should be using. We have to rely on symptoms. But in these tests, in these salivary tests, there are a number of false positives. There are no false negatives. So they do have some clinical application, but you just have to understand the caveats of that test and what we're measuring, so you don't misinterpret that data.
Yeah, my concern is that isn't it not too late if I have symptoms? How is your view? How can I reverse that? Is it, how can it be preventive? So I was watching your video about mouthwash, for example, because you're thinking about, I don't use mouthwash for many years. I just feel like there's too many chemicals there. I don't know. For me, I'm a lay person. I like too many chemicals. I'm already, my husband works with chemistry, and I'm like, I don't know. I see all these chemical names here. I'm out of it.
Yeah, no, look, the data are very clear that mouthwash is really disrupting nitric oxide production, disrupting the oral microbiome, and causing a lot of systemic problems like high blood pressure. You lose the protective benefits of exercise. So getting to your question, obviously it's easier to prevent disease than it is to treat it, right? So in Western medicine is a reactive approach, right? People don't react until they get sick or get symptoms. And I think, unlike you and I, who try to be proactive and do the right thing so we don't get sick or don't develop symptoms, we're kind of the exception to the rule. We're the anomaly. And so most Americans don't take action until they have problems. And the beauty about nitric oxide, and what we've been able to demonstrate clinically and scientifically over the past 20 or 30 years, is that it can reverse chronic disease. So if you have high blood pressure, you restore nitric oxide, it can normalize your blood pressure. If you have sexual dysfunction and you restore nitric oxide, you can restore normal function. We've actually seen people with overt cardiovascular disease, plaque already in the lining of the blood vessel, that we can reverse and regress within 6 months. Wow. So it appears that,
that's huge. Obviously, let's call attention, but this is huge.
It's really what I consider to be the most important molecule. And once we get this message out, it will change the landscape of healthcare and medicine. And I think it will be the way we treat patients for the next 100 years, because your body cannot and will not heal without nitric oxide. No matter how many medicines you give, no matter how many surgeries you perform, without nitric oxide, the body will not heal or perform optimally.
Yeah. Not every lab will be happy, or pharmaceutical company will be happy with you.
No, this is what we're doing.
Changing this landscape.
What we do is very disruptive, because once you can get people off prescription medications and allow their body to do what it's designed to do, then that's very disruptive to big pharma and the economic model for that. But I think it's certainly the right thing to do, because physicians and scientists have really ignored or forgotten how the human body works. We're never designed to take a synthetic molecule that inhibits a biochemical reaction that we were born with. And most drugs are inhibitors of biochemical reactions. So what we do is completely different. We just give the body what it needs and let the body do what it's designed to do, and that's heal itself. And that's the importance of nitric oxide, is we're basically giving back a molecule that the body's deficient in, and now things begin to work again.
Yeah, and that's definitely disruptive.
Very disruptive.
And I'm glad you're a disruptor.
Well, I tell you, I don't know if I would recommend it, because you become a big target and people come after you. Because
I was gonna ask that, because it can be life-threatening. I don't want to exaggerate, but I think it can be.
No, it can. Like, I've got people coming after me, trying to destroy me, trying to minimize my science, our contributions, because this will change the world, and it will change the way that things are done and the way people are treated for a number of years. So, I'm a target to a number of frivolous lawsuits. People come after me, they try to destroy me, but I wear that as a badge of honor, because if you're doing something that doesn't matter or that's not important, people leave you alone. When you're doing something that's very important and disruptive, you become a target. So I wear it as a badge of honor, and I'll continue to fight because the truth is on my side.
Yeah, and it is the right thing to allow the body. I have been talking to other doctors here in the summit also, who are all saying the body has inner wisdom. The body knows how to work properly. We are the ones who are bringing things to the body that is disrupting this, and then that's confirm exactly what you're saying, which is, the body can heal because then it has the proper environment, terrain, and everything, and we are not giving this all other things that are destroying the body. So, or
Absolutely.
say that it fix or quite doesn't fix, but manage something here and destroy over there. Yeah.
Well, I've learned in 25 years in academic medicine that people get sick for two reasons and two reasons only. The body's missing something that it needs, or it's exposed to something that it doesn't need. And so if you eliminate them, if you address those two fundamental issues, then the body heals itself. Going back to the days of Linus Pauling, where his thought was that most diseases are due to nutrient deficiencies. Well, that's an easy fix. We can do micronutrient analysis, figure out what you're deficient in, supplement, replete those nutrients. And then we got to figure out what's in the body that's disrupting normal metabolism. Is it mold and mycotoxins? Do you have some latent infections? Do you have some dental infections or some dysbiosis somewhere that's disrupting normal metabolism? And then you remove yourself from the source of exposure, you give the body what it needs, the body heals itself. So in that model, there's no room for drug therapy, because our body's never missing a compound that inhibits cholesterol production, right? Our body's never missing a synthetic compound that's inhibiting a biochemical reaction that we were born with that's necessary. So I think this changes the whole landscape of how we not only look at the management of chronic disease, but how we treat patients now going forward.
Yeah. And so let's talk about the involvement. Yeah, you already mentioned, but I like to bring back a little bit more of this involvement of nitric oxide and autoimmune disease, because most of our audience at the summit has some type of chronic or more than one sometimes autoimmune disease, the involvement with the immune system.
Well, if you look at what happens in all chronic disease, there are three finite responses to the infinite number of insults we get every day. So there's always inflammation, oxidative stress, and immune dysfunction. And obviously the focus on this summit is on immune dysfunction. Mm-hmm. But when you look at what nitric oxide does, it controls every single one of those. Nitric oxide is what mitigates the inflammatory response, inhibits that inflammatory cascade. Nitric oxide shuts down the oxidative stress. It shuts down hydroxyl radical superoxide production from the three main sources. And then it basically normalizes the immune response. And so without nitric oxide, you cannot correct any chronic disease, including autoimmune disease, because all those are hallmarks of autoimmune disease. But so that's kind of the basic fundamentals. But for autoimmunity, you've got to figure out what caused that disruption in the normal immune response. And for me, it all goes back to, introducing something into the body's not used to seeing. Mm-hmm. And I'm a biochemist and physiologist by training, and this goes back to stomach acid production. So when we eat proteins, whether they're animal proteins, plant proteins, you have to have sufficient stomach acid production in order to break down those proteins into amino acids. So humans are never designed to incorporate animal proteins or plant proteins into our own protein machinery, right? We break down those into amino acids, we incorporate those amino acids, and then the cell makes human proteins, not animal proteins. But yet there's an epidemic of antacid use. There's over 200 million prescriptions written every year for antacids. And that's not even counting the over-the-counter purchases. So when you shut down stomach acid secretion and then you eat protein, you can't break those proteins down into amino acids because you need stomach acid to do that, then now you're dumping these peptide fragments into the gut, that are absorbed across the gut, and your body sees that as a foreign invader, as an antigen. And then your immune cells go and they attack. So now every time you drink milk or eat peanuts, the particular peptide fragment you develop a food allergy to it. And then now your body's attacking itself every time you're exposed to that. So for me, from a simplistic standpoint, almost all autoimmune disease can be traced back to insufficient stomach acid production. And most everybody's been on a PPI or on an acid at some point in their life for reflux disease. Even as a baby, when they develop, these babies start to regurgitate and throw up, and you take them to the pediatrician, the first thing they do is put them on an antacid.
Doesn't make
that
any
affects
sense.
the
It's quite
health.
normal.
Yeah, and that disrupts their health for the rest of their life. So it's the most dangerous thing you can do. And these drugs were never approved for chronic use. But yet I know people who have been on these antacids for 5, 10, 15, 20 years. And it explains every single one of their chronic disease and symptoms.
Wow. I have read, but I forgot the number now, but it was, I think, one of the most common of anti-acid medicine, the sales in millions of dollars, and this is number one in the whole world. And I'm like, oh my God, this is, I don't remember the number now, but I just remember the name of the medicine, and I'm like, oh, this is horrible. This is horrible because
no, it is between the proton pump inhibitors and cholesterol medicines. They're always the top 3 drug revenues for drug sales around the world, and omeprazole is $1 billion.
That's exactly the one.
Drug. Yeah, no, and it's causing chronic disease, and it's causing. There was a report published, I think, in 2015 by my good friend John Cook, and revealed that people who have been on these PPIs for 3 to 5 years have about a 35 to 40% higher incidence of heart attack and stroke.
Wow.
And that's because these drugs are disrupting nitric oxide production, and you get the increase in cardiovascular risk, heart attack and stroke goes up. So these are very, very dangerous drugs that should never be used more than 3 days at a time. But yet, as I said, people have been taking these every day for many, many years.
And
acids
then they give another medicine for blood thinning, because then you might have a heart attack.
Yeah, that's right.
That's the
it's a vicious cycle. But it's a perfect financial model for pharmaceuticals, because you get one person on one drug, now you got to give them another drug to counteract the effects of that. So it's a beautiful business model, but unfortunately, it's not making anybody better. In fact, it's making people sicker.
Yeah, that's why awareness and consciousness and being here and talking and spreading this word is very important. And I really appreciate your contribution here, because this is very important for people to know. And that's exactly the medicine I was reading about. It's like, so how can we restore nitric oxide production? That's very important, because we already know, okay, I probably have diminished nitric oxide production in my body. How can I do anything about it? And
well, I think it's
we're going to connect with your page to know what you have there. People can see the link below, and I will talk a little bit about that. But tell us, how can we restore?
Yeah, I think it's the most important answer to the most important question in medicine today. And so I tell people, you have to do 2 things. You have to stop doing the things that disrupt nitric oxide production, and then start doing the things that are clinically proven to restore. So if you take those one by one, so stop doing the things that disrupt nitric oxide production. If you're using an antacid, you have to stop. Because your body cannot and will not heal without stomach acid production. It disrupts nitric oxide production, disrupts the breakdowns of proteins into amino acids. Number 2, you have to get rid of mouthwash. If you use mouthwash, you have to stop. We and others have published that people who use mouthwash, it disrupts the oral microbiome. There's a lot of these bacteria that are in the mouth that are responsible for generating nitric oxide. If you disrupt that, you shut down nitric oxide production. And then you have to get rid of fluoride. Fluoride's an antiseptic, it's a neurotoxin, and it kills your thyroid function. So if you're using a fluoride toothpaste, you have to get rid of the fluoride. Buy a fluoride-free toothpaste. In most cities around the US, they put fluoride in the drinking water, in the municipal water. So you have to get a home filtration system that removes the fluoride from the water that you bathe in, that you drink, that you cook in. Fluoride is one of the most toxic molecules out there, and yet everybody's exposed to it. So those are the 3 main things you have to do to stop disrupting nitric oxide. get rid of fluoride, get rid of antacids, and get rid of mouthwash. Now, once you do that,
I have to say that I use a toothpaste, very expensive toothpaste. It's a Japanese toothpaste that has many herbs, and I bring from Japan. I used to live there because it doesn't have fluoride and has herbs to help to clean. And I don't use mouthwash without knowing any of this. I'm like, oh, I'm guided here to do this. So very good. So now I have a filtration, but not everything in the water I think is filtered. But
yeah, now we have good intuition, and because these are very toxic chemicals that we're exposed to. So now that you've done that, now you've really allowed the groundwork for the body to heal. So now you can start doing things to stimulate nitric oxide production. And that's eating more green leafy vegetables or getting a source of nitrate. Moderate physical exercise, as little as 20, 30 minutes of moderate physical exercise a day has been shown to stimulate and activate nitric oxide production. Sunlight, there's certain wavelengths of light, both UV and infrared, that can liberate nitric oxide. And that's why, sunlight has been shown to normalize blood pressure because of nitric oxide. The other is deep breathing, nasal breathing.
I was going to ask because I heard that breathing through the nose helps the nitric oxide production. I want to confirm with you if it's not a tale story.
Well, it does as long as the enzyme is functional. Mm-hmm. So there's a high concentration of this enzyme, nitric oxide synthase, found in the epithelial cells in our airway sinuses. So when we do nasal breathing or deep breathing, these mechanoreceptors on the epithelial cells are activated, which turns on nitric oxide production. And we've been able to quantify nitric oxide coming out of the nasal sinuses when people are deep breathing. But the older you get, the less nitric oxide you make through that enzyme. Mm-hmm. So, but regardless, we aren't designed to be mouth breathers, right? So we have to do the nasal breathing. And so the other thing with mouth breathing is you disrupt the oral microbiome, right? Yeah. So there's other benefits of nasal breathing that are independent of nitric oxide. But provided that enzyme is functional, nasal breathing and deep breathing can produce nitric oxide, lower blood pressure, kind of turn down your sympathetic nervous system. And then the other thing, those are 4 really simple lifestyle changes that people can do that typically will restore nitric oxide production. And when all else fails, my 25 years in academia, we've discovered a number of new innovative pathways, and we have product technology that actually generates nitric oxide for you. So our whole philosophy going back 20 years ago was if your body can't make nitric oxide, then we have to do it for you. So we've developed an orally disintegrating tablet that when you put in your mouth over 5 to 6 minutes, as it's slowly dissolving, it's liberating this nitric oxide gas. It's absorbed, it dilates blood vessels, improves oxygen delivery. So we have products out there that makes nitric oxide for you. It's really been had a remarkable impact on human health.
Oh, wonderful. So talking about that, I would like to talk about your free gift for the audience. Yep. Dr. Bryan is offering us the ebook called Functional Nitric Oxide Nutrition. And I think we all should get this ebook because we will understand and know better about this. And in order to get this, you just have to click the button below. Just wait for the interview to finish, but click the button below so that you can get a connection to his homepage and also get the ebook, get information, inform others as well, because we all need to be healthy through something that most of people, I think, never even heard about. And I think that's so, so important. And I don't think we're going to hear this in the news because, as we know, all the commercials are coming from pharmaceutical labs. So you're not going to see in the news. We are the ones who has to spread. And I think getting more information, connecting with him and connect with his homepage, it's very important. So click the button below. So we are finishing our session here, but before we end, I would like you to give just a final word for a person who is suffering from NO deficiency, even though you already gave all the tips and those things that we can do on our own. But what would you say?
Well, I think that especially the people who are going to be viewing this summit are dealing with some chronic disease, autoimmune disease that's been poorly managed by their physicians, and they're looking for alternative approaches or really a different approach to get better. And so hopefully this offers up a new thought process on, the consideration around nitric oxide. But people with autoimmune disease, from my experience, there's always a cause, and you've got to figure out what's causing the autoimmunity. And 90% of the time, it's usually some foodborne antigen, a foodborne allergy, or something you're exposed to in the environment. It could be mold and mycotoxins. It could be, herbicides, pesticides, things in your food that are disrupting the microbiome and causing immune dysfunction. So I challenge everybody with autoimmune is start to recognize what your body responds to. Keep a food diary and then watch the flare-ups. There's always patterns that develop. And then, most importantly, I think we have to start focusing on nitric oxide to restore blood flow, to shut down the inflammation, the oxidative stress, and the immune dysfunction that allows, to kind of calm down the body until you figure out the source of exposure. Because as important as nitric oxide is, it's foundational. But if you don't recognize what's causing the autoimmunity, you're never going to fix the underlying problem. So nitric oxide is not a panacea. It's not a silver bullet. It's not an end-all, be-all, cure-all. That it is foundational for everything else you do.
Oh, thank you. Thank you. That's so wonderful. That's a very good advice. And also explaining, because I think the root cause of autoimmune is where, lies the reversing it or even healing it. Is toward that, I think the summit is about the root cause, going there toward finding and discover, which reminds me of one of the speakers who had MS was saying lettuce was something that brought her a flare-up. And many times we go, I eat vegetables, but lettuce can be something that can be not good for a particular person. It's very important, the message that you said, keep a food diary and notice what brings some reaction in the body in terms of flare-ups or anything. Yeah. Thank you so much. I really appreciate your time and especially your expertise here over decades of researching this and bringing us this information, which is so important and so new. It's for us very new also. Yeah. So very important. Thank you so much for this session. I really appreciate your presence.
Thank you. Thank you for all you do.